And now, I said at the start of the show that we've heard a lot about numbers and data in the last few weeks. So let's try and make some sense of some of that. We're joined now by the Chair of Global Public Health at Edinburgh University, Prifessor Sridhar. Thank you so much for coming on the programme today. Now, it feels as if the number that the government is talking about an awful lot at the minute is the R number, the rate of infection, and what measures of the lockdown have the biggest impact on that R number. What kind of things do you think the government could be looking at tweaking in relation to R in the coming week?
Yes, exactly. R is a really important number because we have to keep it below 1. If it goes above 1, that basically means we'll see exponential growth in cases again, and then likely have to take more drastic measures to get it back beneath 1 again. And so the measures that are being looked at are, for example, trying, since it looks like we are below 1 now, is perhaps, letting some kind of outdoor activities go ahead. For example, looking at schools and how this might affect that face masks now, how might that play in, even if it's very small, as well as the biggest chunk, which might be test, trace, isolate, which is a way of just quarantining those who are carrying the virus instead of quarantining everybody.
We've talked quite a lot about schools on the programme. There have been reports that primary schools could reopen, and it feels as if there's some dispute about how much children actually spread coronavirus, whether or not they are big carriers, that they can spread it a lot, even if they haven't got symptoms. What's your understanding on that?
Yeah, exactly. I think the consensus is that children are carriers of the virus, because there was a time when we weren't sure could they even carry it. And now the debate is over the degree to which they can infect others. And here, of course, the concern is for teachers, for parents, grandparents, basically others they might be exposing if they're, transmitting within a school environment. And so different governments are taking different approaches to this, first based on actually how much risk they want to take. And are they going to err on being more cautious? So you're going to hold back and wait to get more information? Or do you feel like, we need to get schools back? And so, you're seeing countries like Denmark opening schools and then keeping in place monitoring to see how this actually affects further spread. I mean, it also depends where you are in terms of actually your R number. If you have a lot of wiggle room, then actually you can do these kind of, small experiments in a sense to see actually, can we open schools for a limited amount of time? If you have a large number of cases, you don't have proper surveillance in place, you don't have a test, trace, isolate strategy in place, it's very hard to open schools because actually if you do set up a whole new set of cases, then it's harder to bring that under control again.
We've also talked a bit about older people as well. Just heard from Baroness Ros Altman, who was effectively saying it was age discrimination, that people above a certain age should not be allowed to see their friends and family if the rest of the population do. Do you agree with that? What's your view on it?
Yeah, it's a really tricky one because, I really sympathize with, the idea of shielding because it can also be seen as locking people away, and there has to be a better way of doing this. And so I think what we really need to do is be getting out of the situation where we're trying just to shield the vulnerable and actually really aggressively go after the virus. This means actually having widespread testing, actually tracing contacts, actually figuring out, through surveillance systems as well, of geographically where is the virus within the country. Because if you are finding that there are certain parts of the country where actually, we have very low numbers of cases, or you have more wiggle room in your R number, then actually there could be ways to actually move away from just shielding elderly and vulnerable individuals. I mean, it's also worth noting that while we know at a population level and we're learning more about risk factors or how it relates at a broad stroke level, we still don't know at the individual level why it is that still people in their 20s and 30s who are healthy, especially in healthcare settings, can get severely ill from this. So these are still things we need to look at.
It's interesting to hear you say there about different parts of the country perhaps having lower levels than others of infection rate. If that is the case, do you think that there is an argument that the lockdown should be eased in different ways in different parts of the country?
Well, from the start, a lockdown is a very crude policy instrument to basically delay the spread of the virus. It's like pausing time to build up the necessary public health infrastructure and actually get the virus back into your line of sight to know where it is. And so I think what we need to be doing is building local, decentralized, data-driven systems to actually understand what is happening on Scottish Islands, what is happening in Cornwall, what is happening in London, and then actually implementing policy interventions that react to those. I think in terms of, lockdown, yes or no, it probably won't be like that, like a light switch. It'll probably be easing of restrictions. And, I would be supportive of schools going back in areas where actually it does seem that there are very low numbers of cases. What you don't want to have happen, and this is the big worry, is that there's a flood of people from an area where there is lockdown to an area where there's none. So from urban to rural areas, across, the 4 nations. And so actually at that point, then, there needs to be thought given to actually anticipating that, because that's a terrible unintended consequence of a geographic, different policy.
Yeah, you say you don't want everyone to be flooding to the Scottish Islands to go and have a quick pint on the Isle of Skye if they're able to. Just finally, you're talking a lot there about data, and it seems that data is going to be a big part of the way out of this, through the contact tracing, for example, looking at the R number. Have we been a bit slow on getting that data, getting that testing capacity up and getting the analysis that we need?
Yeah, definitely. I mean, I think in the UK, we were stuck for quite a long time on, does testing matter? What should we be doing? We were also having mixed objectives. Is the strategy to actually stay within NHS capacity and everyone is exposed to this virus? Or was the goal actually just to drive numbers as low as possible and try to keep this and suppress this virus to very low levels? And so I think now what we reach consensus of is that actually the best way out of lockdown is to replace lockdown with test, trace, isolate. But this requires testing, massive testing, about 100 tests for each daily new case. So this means in the UK, if we're seeing, on average, we probably would be needing about 500,000 tests a day. So still a long way to go unless we can get daily new cases down during lockdown. It also means tracing capacity, being able to actually, identify people quickly and figure out the week before who were they in touch with, get in touch with those people, given we know pre-symptomatic transmission is there. And the third piece we haven't heard discussed as much is isolation. How do you actually get people to isolate, whether it's in their homes or whether it's in other facilities, for a certain amount of time, let's say 14 days, to make sure that they pass the period of infectiousness and are not passing it on to others. So yes, we really need to be building all three of these in tandem and having a public conversation of how do we address these, because it's going to affect everybody's lives. It already has affected everyone's lives, and people need to understand how this is going to develop.
Okay, thank you very much for being on the programme. Some really interesting stuff discussed there. Thank you.
Perfect, thank you.